Morning, everyone. Thank you so much for being here this morning. My name is Nisha Agarwal, and I'm the Commissioner of the Mayor's Office of Immigrant Affairs. And I am delighted to be here with you to make a really special announcement about IDNYC. For those of you who don't know, IDNYC is the city's municipal ID card program. It's also the country's largest program with more than 830,000 New Yorkers who signed up for the card so far. And for immigrant communities, which my office works with, it's been an invaluable bridge to a number of different services and the only government-issued identification card that's available in New York regardless of immigration status. We have heard countless stories of empowerment, really, from New Yorkers who've used this card, for individuals who can now use the ID to interact with law enforcement, to mothers who can enter school and pick up their children with confidence and participate in the PTA. New Yorkers also love the benefits of IDNYC, from linking your library card to your IDNYC to the free memberships you can get at 40 different cultural institutions all around the city. And today, we are delighted to be announcing another slate of benefits focused on healthcare. First, starting this summer, IDNYC cardholders and their families will be able to access children's immunization records via DOH-MH's new system. IDNYC has also partnered with the New York City Health and Hospitals Corporation to allow IDNYC cardholders to link their cards to their health and hospitals patient record. The initial New York City Health and Hospitals rollout will begin right here at Coney Island Hospital and will go citywide throughout 2016 and 2017. And finally, IDNYC will also serve as the membership card for the new Action Health NYC program, which is a program that will serve patients at health and hospitals in Elmhurst, health and hospitals at Gouverneur in Manhattan, and at a number of community-based health centers. Action Health NYC is for immigrant communities that currently do not have access to health insurance. The speakers here today will discuss how these integrations are fulfilling our promise of delivering services more easily to New York's most vulnerable communities. And before I introduce our Deputy Mayor, I just want to acknowledge some guests who are in the audience and thank them for being here. Dr. Timlin of the Chinese American Social Services and a member of the Coney Island Hospital Advisory Board. Roseanne DeGennaro, who's the chair of the Coney Island Hospital Advisory Board. Pamela Pettyjohn, who is the president of the Coney Island Beautification Project. Barbara Rosado of the Coney Island Hospital Women and Children's Health Services. Ben Goker from the Brooklyn Public Library. And Warren Chan of the Asian Community United Society. Thank you so much for being here. And now I'm delighted to introduce our Deputy Mayor, Richard Beery, who among many other things has brought pre-kindergarten to every four-year-old in New York City. Thank you so much.
Thank you.
Mayor.
Thank you, Commissioner. Good morning. Good morning. First of all, I want to thank you, Commissioner, for your incredible leadership. I really believe that IDNYC, I feel like I have to bring my prop out. Hold on. There we go. I feel like IDNYC is really one of the most incredible public policy successes that this city, any city, has ever seen. And so, first of all, I just want to give a lot of credit to the Commissioner, to the team at the Mayor's Office of Immigrant Affairs, and all the parts of city government that have been such critical parts of rolling out this program. Congratulations to you. Why today's announcement is so important. It's so important for Mayor Bill de Blasio's vision for New York City. Because I believe if there is any single North Star to this administration, it is the idea that we must be a more equitable city. And by equitable city, we mean a city where everyone who lives here has full access to opportunity, full access to dignity, full access to public resources, full access to all the things that make living in New York City so wonderful. And for too long, it has not been true. Although we all live in this city, we do not all have the same access, particularly our citizenship status, our race, our gender, all these things so often stand in the barrier to our ability to fully enjoy the life of the city. And I think what makes IDNYC so powerful and what makes today's announcement so powerful is what they represent for our ability to remove those barriers, the barriers that stand in the way of all New Yorkers truly enjoying what it means to be a New Yorker. And with that, it is my honor to introduce the President and CEO of New York City Health and Hospitals, Dr. Ram Raju.
Thank you. Thank you, Deputy. Thank you, Deputy Mayor, and two of the most important commissioners who really fight every day for equity in healthcare and equity in life. And we are so happy to partner with you to do that. So, I am also a proud card-carrying member of New York IDC, IDNYC, because I'm so happy to be a part of that. But this, as Deputy Mayor said, empowers everybody. We all carry the same card, right? That shows that we as New Yorkers are equal, that we will get everything done through this. So we are very happy to be a part of these healthcare services because, as you know, New York City Health and Hospitals is always in the forefront of taking care of people, the most vulnerable amongst us. We turn no one away. We take everybody. Last year alone, we provided close to 475,000 uninsured people in our system. And we are very proud to do that. And we believe that's a privilege to do that. So carrying the card and linking it to our healthcare delivery system is a great step forward.
Good morning, everyone. I'm Dr. Mary Baston. I'm the Health Commissioner for New York City, and I'm just so delighted to be here. I'm a proud product of the health and hospital system. I did my medical training at Harlem Hospital, and I know how lucky we are as a city to have a robust public hospital that delivers services for all. And I'm so pleased to be here today as Coney Island takes the first step on linking up making government work for us through one card as much as we can. And Commissioner Agarwal didn't tell you how incredibly more subscribed the IDNYC was than any of us expected it to be. Our deputy mayor did what everybody thought was impossible. We now have 68,500 kids or something like that, who's counting, in pre-K. And we have an ID that for all New Yorkers who live here that it has served something like 3 times as many people have gotten it than we expect. So this is my wallet. I have to do what all my fellows have done. And in my wallet is my IDNYC. I use it every day whenever ID is asked of me. This is the ID I show. And we are now today announcing ways in which we're going to continue to make New York work for everyone who lives here through this ID.
I would like to introduce Blondie Medina, who is a patient here at Coney Island and has been for 19 years, to speak to IDNYC and her experience.
Good morning, everyone. I'm very happy to be here. Proud IDNYC cardholder. And I've used it in a few ways to pick up my children from school, to file a police report, and then also to file some paperwork for my family's small business. I'm very happy to hear that soon I will be able to use my IDNYC to have access to my child's immunization records, which are so important to enroll in school.
Thank you, and now we'll take any questions from the press.
It says that more than 800,000 people enroll with this IDNYC. Are you satisfied with the enrollment because there are 8 million people in the city?
Yes, so I'll take that question and then turn it to Dr. Raju for how you can link to the health record. So we are over the moon about the response that the municipal ID has had in New York City. We basically have 1 out of 10 New Yorkers who could enroll for the card enrolled in the first year of the program alone. And that is astounding. In this area in Coney Island, I think we have something like 24,000 people, maybe more, who signed up for the ID card. So the response has been tremendous. That said, if you don't have one yet, you should join the hundreds of thousands of other New Yorkers who have signed up for the card and enroll. It's very quick, it's very easy, and appointments are available in the 5 boroughs as soon as tomorrow. So please do sign up if you haven't already. And now, Dr. Raju.
Everybody who comes to our system carry a clinic card. The idea is to, link this card to the clinic card, so eventually this card will be the clinic card in all our hospital systems.
Taking more questions, I just want to acknowledge that Assemblywoman Harris is here and has arrived. Thank you so much for joining us.
I represent the 46th Assembly District, which is one of the largest districts when it comes to housing developments and senior citizens and youth. I think it's youth, senior citizens, and then it's little old us in the middle. What I've enjoyed with my before becoming an assemblywoman is, one, being a retired New York City correction officer, but two, being the executive director of a not-for-profit teen media arts program. And I have had the pleasure of registering or helping to register 70 teens in the program, in the IDNYC program. So what we have able to do together, I'm also registered, I have my card in my car behind my driver's license, is we have partake in the aquarium and Bronx Zoo. So we have utilized those services immensely.
आज हम बोल रहे हैं कि IDNYC के साथ आपको हेल्थ केयर हॉस्पिटल्स में एक्सेस आ सकता है और वो बच्चों का इम्यूनाइजेशन रिकॉर्ड्स आपको एक्सेस कर सकते हो वेब के हॉस्पिटल के साथ अगर आप इनिशियली कोनी आइलैंड हॉस्पिटल में आओगे simply you just have to go to the desk or बोलना है कि मेरे को patient either I want to become a patient here आप दिखा सकते हो आपकी ID और link automatically happens. Very easy.